Thank you, Janet and Jaime. Well, we've heard about statistics. We've heard about what actually, the financial impact is and what the impact is overall. But let's bring it down to an individual level. What's it like for a patient? Well, you've heard a lot about AFib today, but do you know what it actually feels like? Has anyone here ever had atrial fibrillation, AFib? Okay, so I'd like for you to have a chance to know what it really feels like. Think about sometime when you've been exercising or running, just all out. And maybe your heart feels like it's up here in your throat, going thump, 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 very quickly. You get maybe dizzy and lightheaded, maybe your arms and legs are tingly, and that's because you're not getting necessarily enough oxygen to your body and brain because you've just overworked it. Well, that's kind of what it feels like to have atrial fibrillation. But let's add a dance step to that as well. Let's think about your heart's going thump, 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 and it's actually starting to dance. It's kind of like dancing the Macarena. Or maybe it's jumping around like an unbalanced washing machine up here in your chest. Can you picture that? Or maybe it's like having a big old bass flopping around in your chest. That's what I used to feel like. Think about trying to work or concentrate, feeling like that all the time. Or trying to sleep. Or trying to exercise when you can barely even catch your breath. It's really difficult. So that's what atrial fibrillation feels like. But there's much more to living with atrial fibrillation. As I mentioned earlier, I'm an atrial fibrillation survivor. Back in 2003, I was in my home office working when all of a sudden my heart felt like it skipped some beats, and then it took off racing and pounding and flopping like a fish. I got dizzy, lightheaded, thought I was going to pass out. My right leg was as white and as cold as snow, and I had blurriness in my right eye. Well, went to the emergency room, and they said that I'd had blood clots and a near stroke from this condition called atrial fibrillation, which I'd never heard of. Well, they said, we're going to give you a beta blocker, which will slow your heart rate down, and a blood thinner, Coumadin, to prevent a stroke, and you'll be fine. But I wasn't fine. AFib episodes started coming very rapidly, just every few days. And I remember one particular day, just a few days later, where I was out walking my dog. And I was probably half a mile from home. And all of a sudden, my heart felt like it skipped some beats and took off racing. I looked down at my heart rate monitor, and it said 170, 200, 230. When it got up to 250 beats a minute, my chest was hurting. And I thought, am I going to pass out? Am I going to have a stroke right here off by myself? As it hit 270 and 300, I called my husband to come get me. And it seemed like it took him forever. It was probably only a couple of minutes, but it felt like forever. When I got home, I took another one of my beta blockers, and my heart rate slowed down. But after that, I never went anywhere without my beta blocker and my cell phone, even just to walk out to the mailbox. Well, the worst for me, though, was the blood thinner, the Coumadin, because I couldn't do yard work. I couldn't use kitchen knives for fear of cutting myself and bleeding to death. Couldn't even shave my legs. Well, being on Coumadin means, at least for me it did, it meant that I was ping-ponging between blood that was too thick with the risk of a clot and a stroke, and blood that was too thin with the risk of bleeding to death. I was literally black, blue, and purple all over my arms, my legs, my torso, even my face. It was really embarrassing. Everywhere we'd go, I'd hear my husband say, "It's the Coumadin." No, she's not battered. But I looked like I was. Well, I often heard, if you just eat right, you'll be fine. I ate right, but I wasn't fine. I was never stable on Coumadin for genetic reasons. About a fourth of people who are on this medication are not stable for genetic reasons. So when you've had blood clots and a near stroke, AFib becomes terrifying. Will you be off by yourself and have a stroke and die? I was literally a stroke walking around waiting to happen. And so my family wouldn't let me go anywhere by myself for fear that I would be by myself and have a stroke. So AFib was really hard on all of us. Well, after less than 2 years, I discovered a new procedure. So I had a surgical procedure that hopefully cured my AFib. But at the very least, I have been AFib free for 5.5 years now. Well, I hear, and as I told you, I started stopafib.org because I wanted to help others go through this, because it's a terrifying experience for many people. So I hear from about several hundred patients a day, and I go out and speak at hospital conferences about AFib around the country, and speak to thousands of patients there. And then I also reached out to patients to find out what they would like for me to share about living with AFib. The most common word that I heard was fear. Fear of having a stroke or a bleed. Fear of what people would be doing when the AFib beast struck. Fear of having to cancel their plans because of AFib, and what family and friends would think as a result of having their plans canceled. And fear of being a failure because AFib had taken control of their lives. AFib is also a very expensive disease. This was a study that was done among Medicare patients where they found that the medical costs for those with atrial fibrillation were 5 times greater than for those who didn't have atrial fibrillation. And the average cost per year was $24,000. In the first 15 months of a patient being diagnosed with AFib, they averaged 67 physician visits. And this is on Medicare. And about 60+% had several emergency room visits, averaging about 3 visits in that first 15 months. So AFib really takes a huge toll, not just on you, but on your family too, and even in the workplace. So AFib is physically exhausting. When you have an episode and it's over, you feel like a limp dish rag, and all you want to do is just sleep for days. AFib is also an emotional roller coaster, up and down. Whenever you're in an episode, you literally feel like AFib has taken over your world, and you don't have a life anymore. And AFib is financially devastating. You saw the medical costs, but that doesn't take into consideration what it costs the individual and their family. So the financial devastation comes from things like AFib patients being the frequent flyers of the emergency room, with the high medical cost or even just high copays that result from that. And then if you're sick a lot, you're in the emergency room a lot, you're in the hospital a lot, you miss a lot of work. So you may be deemed unreliable and therefore lose your job and your insurance. It's even worse if you're self-employed like I was and you just can't function to work. Many people with AFib lose cars, houses, everything, even their families. And you'll do anything to stop the AFib. Well, AFib is one of those things that we're too embarrassed to talk about the financial impact, but we really have to start doing that because it's not just on our families, but it's on our country as well. The impact on Medicare is staggering. So, if you'd like to learn a little more about AFib, there's certainly the statistics in the Silver Book Thrombosis, and that's a great place to start. But if you think that you may have someone in your family that has AFib or that you'd just like to learn more about it, stopafib.org is a great resource. We have just above where it says news from stopafib.org down there, there's a link that says get started learning about atrial fibrillation. And it takes you to this page that talks about what is AFib, why is it a problem, the stroke, the heart failure, even the dementia and the potential of Alzheimer's. In addition, it talks about the different treatments, how it's diagnosed, and just a lot of information about AFib. In the lower right is a seal called the HON code seal, that red, white, and blue seal. And that's from the International Health on the Net Foundation, indicating a trustworthy medical site. And the reason I point that out to you is we're always, everybody wants to know, how do I know a really good, trustworthy medical site? If you're on a site doing, your medical research for any kind of condition, and you don't see that seal, you may want to look very closely at it. That seal says that you've met some very, very rigorous standards. So to help patients, actually to help doctors help their patients, we've actually created a patient card that we give to doctors to give patients. And there's some of them on your tables. These cards tell what you'll find when you come to our site. But more importantly, I want to point out to you that red puzzle-like thing that you see on the screen. If you haven't seen one of those before, that's called a quick response code or a QR code. If you have a smartphone, there are apps that you can get on your phone to scan these QR codes. And in this particular case, it takes you to our mobile website on your phone's browser. It works for iPhones, Androids, and Blackberries. And so the mobile website pops up, and you can go to our main website, stopafib.org. You can go to our discussion forum or to our blog, to our Twitter page, to our Facebook fan page, to our Stop AFib YouTube channel, and to other places as well. So that's been a really good resource for patients to be able to have access to information on the go. So I know that it's hard to really understand what it's like to live with atrial fibrillation. And I don't want any of you to have it, but I do hope that walking with me on this journey today has given you some understanding about AFib and why it's important that we do something about it. And working together, we can do something about it. So thank you for the opportunity to share with you today. Thanks.